Okay, I'm going to be talking about motivational interviewing. So, the On Your Own lesson we did on motivational interviewing focused on how a healthcare provider should use motivational interviewing when interacting with patients, right? So, they want to say the right kind of things and ask the right kind of questions so that the client and not the clinician is making arguments for change. So, the role of the clinician is to just evoke concerns and not just tell them. So the goals are to help people make changes to their lives, to minimize resistance, and nurture hope and optimism. So the four core skills for motivational interviewing are open-ended questions. It's important that you're asking questions that allow the patient to express their feelings. Affirmations are important so that the patient feels hopeful and positive towards like the behavior you're trying to focus on, like that they can change. Reflections and summaries are important too because you want the patient thinking about why they need to change, but also it's important that they're being heard and that they know that. So in this lesson, we watched a video of an interaction between a healthcare provider and a mother. The mother had come into the office because her son had an ear infection, and the doctor had noticed that the little boy had had a lot of ear infections in the last year. And she also noticed that the mother had checked the box that there was a smoker in the house, and smoking is known to cause ear infections. So this scenario kind of just is going to focus on how the healthcare provider used motivational interviewing when she was talking to this mother about smoking. So throughout this interaction, the healthcare provider asked a lot of open-ended questions so that the mother had an opportunity to express how she was feeling, right? So one of the questions the healthcare provider asked was like, I noticed that you had checked the box for smoking at home, so I was wondering if you could tell me a little bit more about that. And then the mother was able to explain that, yes, she did smoke, but she didn't smoke in front of her child. Like that was something very important to her, that her son wasn't being exposed to the smoke. And then throughout the scenario, the healthcare provider was also giving lots of affirmations, like saying like you're doing the best that you can. When the mother would kind of throw out a suggestion, the healthcare provider would be like, that's a good suggestion. And that just helped the patient have a good positive experience. Throughout this interaction, the healthcare provider also would say certain things that would allow the mother to kind of reflect, right? So for example, she said, you have lots of things going on and smoking is kind of a way to relax and de-stress. And then the mother could kind of think like, you're right, that is why I'm smoking. Maybe I should find something else that could help me de-stress. And then throughout this interaction, the healthcare provider would summarize what the patient was saying. So one example is the healthcare provider said, so it sounds like you have lots of reasons to quit. You've been successful in the past. Right now, you are just feeling a little hesitant about your ability to do it. And by summarizing, the patient now knows like, oh, this healthcare provider does care about me, and she cares, right? So the key takeaways is that motivational interviewing is goal-directed and client-centered. We use open-ended questions, affirmations, reflections, and summaries to help make the argument for change, and listen to what they say and help evoke their concerns instead of just telling them.